Hey there, my name's Nathan Evans. I'm a pharmacy clinical service manager for Walmart. I have Cobey here with me. I just wanted to thank you for being here with the Tour de Cure in Virginia for Wellness Week.
Thanks, Nathan. I appreciate you having me here.
So I just have a couple of questions here for you. Let's go ahead and get started. So question number one, the pandemic has made it challenging for some individuals to focus on their chronic health conditions this past year, with limited access to in-person medical appointments, medications, and more. Why is it important for those with diabetes or at risk for the disease to continue to test and know their numbers?
That's a good question. Well, pandemic or not, it's vital that people living with diabetes maintain optimal glycemic control to reduce your risk and severity of any infection, including COVID-19 and pneumonia. Your glucose numbers or your blood glucose numbers tell you how well your diabetes is being managed. And managing your diabetes will reduce the chances of having serious health problems, things like cardiovascular disease, hypertension, heart attacks, stroke, kidney disease, neuropathy, and vision loss. So the best way to keep your blood sugar in check is to routinely monitor it yourself with a glucometer. And whether you get one from your doctor or just pick one up over the counter at your local pharmacy, the process is ultimately the same. You'll use a small drop of blood from your finger onto a test strip, and the meter will tell you how your glucose are doing at that moment in time. So we use a term called a goal or sometimes a target. Rather than saying and shooting for a specific number, we say you're aiming for your goal. So you're either above target, below target, at target, something like that. But people with diabetes have targets that should be roughly right before a meal, 80 to 130. If it's after eating, so 2 hours after the start of a meal, it should be below 180. And then this isn't true for everyone. It's just kind of a generalized. So, talk to your healthcare team, your pharmacist, your physician, and make sure that you have your targets fine-tuned for you.
That's a lot of good information, Cobey. So going off that, what are maybe some annual screenings or checks that individuals should continue to schedule, even in the midst of a pandemic? And how can pharmacists assist with these?
No question about it. The lockdowns imposed last year during the pandemic, they created barriers to care for people, especially with chronic conditions like diabetes. Many of us had appointments canceled, may have missed routine clinic visits. A lot of times this is just for your annual checkup to see how you're doing, how the medication's working, and make any fine tune to your medication. And so, among other things, this may have been missed. So for a lot of people with diabetes, it meant sustained periods of unchecked either hypoglycemia or hyperglycemia. Without testing, you wouldn't know. So this can have detrimental effects on the vision and daily lifestyle. So on top of your annual eye exam and foot exams, remember your ABCs. So that's your A1C, which is how your blood sugar is doing over a 3-month period, your blood pressure, and then cholesterol, making sure that these are kept in check. And all of these are offered at our pharmacies. You'd want to get an A1C roughly every 3 months. If you can't get in to see your doctor, that's something we can do for you. Your cholesterol is roughly 6 to 12 months, depending on how it's running. Your blood pressure could be checked daily if possible. And then another thing we would screen for in our pharmacies would be vaccines, because vaccines are so important with people with diabetes. Again, having high blood sugar makes you more susceptible to infection, and vaccines are a good way to prevent these.
Thanks, Cobey. So going off the immunizations, besides the COVID-19 shot, what other vaccines should still be considered based on age and health conditions?
Well, so diabetes is generally a major risk factor for development of pneumonia and even sepsis due to viral infections and bacterial infections. It's about 12 times higher in people with diabetes than those without as far as the risk of death from COVID-19. Much like the flu, many of the complications from COVID are related to pneumonia, which is why it's very important that on top of your annual flu shot that everyone should get every year, also I would recommend the pneumococcal vaccination, and because people with diabetes are 3 times more likely to develop pneumonia than those without. Also, if there's no record of having a hepatitis B vaccine series in the past, it's highly recommended, so hepatitis B. So that would be your annual flu, at least one pneumococcal vaccination, depending on conditions. Diabetes is one that we would recommend it for, and then hepatitis B as well.
All right, and last question for you, Cobey. How can pharmacists play a key role in helping their patients know their numbers and manage diabetes and other chronic conditions?
Well, knowing your numbers, we can help you, one, Improve your testing technique. Sometimes people get a monitor. You'll get a blood glucose monitor from their physician and a prescription for test strips. They'll grab it, pick it up, and don't really know how to use it. So a lot of times, if people are new to diabetes, we can go through that with them, show them how to use their meter. These days, your pharmacy is pretty much your neighborhood clinic. Pharmacists are the experts on medication. And the biggest reason that we see medications not work for people for their diabetes is they're not being taken as directed or as they were prescribed. And we want to review your drug therapy to help improve medication adherence. We review what you're taking, how you're taking it, and suggest changes. We can help remove barriers. So if cost or access to transportation, side effects are keeping you from taking it the way you should, we can help basically make changes to that. We can reach out to the physician for you. We also want to ensure that the vaccinations are up to date, and we'll provide them as needed right there on the spot. In most areas, the pharmacist can perform a variety of basic screenings. So just like the ones you get in your doctor's office, so those finger stick blood glucose checks, your A1C check, cholesterol, we can do total cholesterol and also like a full breakdown, as well as blood pressure. No appointment is needed for these. You can just walk up and ask for a free blood pressure or glucose screening at any time. The cholesterol and the A1C does have a fee. But some people, like I said, are just given a meter and have no idea how to use it. So if you have a meter and need help with it, bring it in. We're glad to help you improve your way you're using it. We created Walmart wellness events to encourage early screening. A lot of times with diabetes, catching it early is a good way to help mitigate complications down the road. So, these early screenings are an opportunity to get free screenings anytime you can come in. That's why we do them in the pharmacy as well. Not as common right now because of COVID, but they are still available. We also we can recommend resources for healthy living. A lot of times with diabetes, the cardiovascular things that come along with it are the problem down the road. As a Walmart pharmacist, I can tell you that Walmart is really big on counseling patients about their medications. So during these conversations, we'll discuss lifestyle changes like diet, exercise, possible smoking cessation. And, sometimes life is hard with diabetes. And when you're talking to your pharmacist, let them know if you're feeling down or having any issues with sleep disturbances. Sometimes all it takes is a small change in your therapy to make a big difference. And we can help do that for you.
Cobey, thanks for being with us today with the Tour de Cure Virginia.
Very happy to be here. Thank you, Nathan.